Straight to the story coming from the Ministry of Health in collaboration with the European Union and UNICEF that have handed over 100 motorbikes to support the implementation of the 2026 reproductive, maternal, newborn, child, adolescent health and nutrition integrated outreach service package and implementation guide. Well, we have 100 motorbikes that have been donated to the Ministry of Health, and this has been done in collaboration with the European Union and UNICEF. This is good news because Zambia is one of the countries that is fighting tooth and nail to improve the health sector so that, we have a productive nation. I think we are struggling. Though we are struggling, I think government has continued to put in effort to ensure that we achieve the universal health coverage. And then when you look at the 8th National Development Plan strategies, we are talking about one of the strategies where government wants to improve public access to public health services and ensure that every person has access to health facilities. So this is very good because the giving away of motorbikes to the health workers is definitely going to help implement the health programs that the government has, starting from maternal, adolescent, child, and newborn. And then recently we had the government launching the nutrition policy. And for sure, a lot of people are not aware about this new policy and how government wants to implement it throughout the country using the Office of the Vice President. So I'm sure these bikes will help a lot in spreading the news about the new nutrition policy that has been launched by the government. And in connection to the same story, there's sad news coming from Southern Province. Today, I think the Zambia National Public Health Institute Director General, Professor Roma Chilengi, was being interviewed, and he says that Southern Province has continued to record higher maternal mortality rates. This is worrying. We know that Choma is the headquarters of Southern Province and it's centrally located. So if there's actually good planning, we should not see a situation where cases of maternal mortality are high in the province. Look at the province today. It has about, 15 districts, over 2 million people. And as we speak, from 20 constituencies, after the delimitation exercise, we have 29 constituencies in Southern Province. So if the Ministry of Health works hand in hand with the local authority the local authorities in the province, they are going to implement they are going to achieve this goal of ensuring that they bring the maternal mortality rates to lower percentage by ensuring that they have these maternity annexes at all the clinics in the province, and this can be done using the Constituency Development Fund. We have 29 constituencies, and each constituency gets about, 40 million? 40 million per constituency. So if they become deliberate by just getting a small percentage from the Constituency Development Fund, they would be able to construct these clinics dotted across the province so that everyone has access to quality healthcare, including the women. So that is very doable. They just need to be deliberate to have a program in place, and they should not stray to ensure that it is fully implemented. And then I go to the other story where the government has received 100 fuel tankers under the Fuel Tanker Empowerment Program aimed at increasing youth participation in the petroleum sector. I think this is a very good program. It's meant to empower the youth. We have a lot of youth that are not in employment, and definitely they want to become entrepreneurs. So the government has come in to help these youths by giving the cooperatives these 100 tankers. And this program started around 2020. Now, I think I have questions with the people, that the previous beneficiaries of this particular program. In 2020, I think we had, I cannot recall the number of tankers that were given out to several cooperatives, but we had some tankers, fuel tankers given to the cooperatives. So we don't know if those cooperatives have accounted for those tankers. How successful are they? I think I would like the government to tell us how those previous cooperatives that benefited from this program have fared, so that you know, if there are any loopholes, you know, those loopholes can be sealed. This particular program is very good in that it's definitely going to empower the youth, and it's going to increase local participation in the petroleum industry, which is very good, because depending on how these cooperatives perform, we are likely to, you know, to see the decrease in the price of petroleum products. I go to the last story, where a 21-year-old suspected defiler has been arrested in Minilunga, Northwestern Province, for allegedly defiling a 4-year-old girl before fleeing, leaving behind his mobile phone at the crime scene, which police used to trace him. Okay, though I'm laughing, this is a very sad story. You can imagine a 21-year-old man defiling a 4-year-old girl. And according to the story, the mother, the incident happened around 02 hours, and this suspect only ran away after the mother woke up. So I have questions that need answers. This is a 4-year-old child. Why is it that she was not sleeping with the mother? And here in the story, it's not indicated whether the lady was married or not. Whether she was married or not, if truly she was in the same house with that 4-year-old child, if she's married and the husband wasn't around, maybe had gone out for some business or whatever, she should have slept with this child. I'm just asking questions. And maybe if she was sleeping in the same bedroom with the child, was she drunk for her not to hear what was happening, for this man to take off his clothes? I hear he even left his coat, he left his slippers and the phone. Where was she for her not to hear all this happening? I don't know. Could it be that they were in the same room and then she did not hear when everything was happening? Or could it be that she was in the other room, in the bedroom, and the child was in another room? If that was the case, if the child was in another room, I would blame her. I would say that that was negligence, because looking at the age of the child is very young to sleep alone. Yeah, that's what I can say. And I hope that this man is going to be punished for the offense that he has committed. It looks simple to those that are not affected, but the child, the 4-year-old child, is definitely going to be affected. This is a this is a baby below the age of 5. And you wonder what some men think, honestly. 21 years old, you can't find somebody that, you know, you can you can have sex with. You just decide to pounce on a child. This is very worrying, and I think the police should see to that this person is punished, so that the would-be offenders can learn 1 or 2 lessons. So this is what I do have for today's analysis. Thank you.
Thank you very much.